A lot of people just don't know the important role that Medicaid plays.
Not enough people know how strong of a program Medicaid is.
37 million children in our country are covered by Medicaid. 40% of kids in rural and small towns are covered by Medicaid. There's also 3 million children that are in military-connected families. Medicaid is the backbone of the pediatric healthcare system. Previous in my career, we'd go in and say that Medicaid covers this many kids, and it was just like blank stare.
When you're talking with lawmakers specifically and trying to educate them about Medicaid, they certainly understand Medicare. Like, no one's confused about that program. Why does there tend to be this ongoing challenge with having them understand Medicaid in that same way? Welcome to Unlocking EPSDT, Transforming Youth Mental Health Through Medicaid. I'm Heidi Baskfield, host of the Speak Our Minds podcast.
And I'm Jason Hopkins, host of Nobody's Perfect. We've teamed up for this 6-part series to share something powerful, something that could transform how we care for kids in this country, yet almost no one knows about it.
It's called EPSDT, Early and Periodic Screening, Diagnostic, and Treatment. A mouthful, but it's not just a policy term. It's a legal promise that's actually built into Medicaid. And it's designed to ensure that kids and teens get the right care at the right time before small concerns become big concerns.
And here's the truth. Nearly 40 million children in the U.S., more than half of all kids, rely on Medicaid. Yet most families, providers, and even lawmakers don't know what EPSDT is or their right to expect it.
So when families don't know what they're entitled to, they don't know what to ask for, let alone what to fight for. That means kids miss screenings, mental health needs go overlooked, care is delayed, or worse, denied, and the comprehensive system Medicaid was designed to be falls short.
We created this podcast to change that, to lift the curtain on what EPSDT really means and how it can become a game-changing guarantee for youth mental health if we understand it, demand it, and protect it.
Along the way, we're going to introduce you to bold leaders, everyday change makers, providers, policymakers, families, all who are showing what's possible when we treat EPSDT like the powerful tool that it is.
And we'll explore how you can be a part of that change, especially through something called the Learning Health Network. These are collaborative communities that bring people together, families, clinicians, advocates, and researchers to share data, challenge the status quo, and improve care in real time.
So this isn't just a podcast, it's a call to action. If you believe, like we do, that kids deserve better, and if you're ready to help shape the system they need, then this series is for you.
Fall in love with what Medicaid can be. Understand your power. Join us in building a movement where every child gets the care they deserve, early, fully, and fairly.
And it starts by unlocking EPSDT. Let's make sure everybody knows what it is and how to use it. Because the more we know, the more we can demand. And the more we demand, the more we build a system that truly works.
So join us, subscribe, and share this series. Welcome to Unlocking EPSDT, Transforming Youth Mental Health Through Medicaid.
Today, we want to welcome Aimee Ossman, who's the Vice President of Policy with the Children's Hospital Association. Aimee, welcome. We're so glad you're here.
Thank you for having me. Really excited to be here.
And I'm most excited to get to claim to be Aimee's very first and certainly not last podcast. So, Aimee, thanks for doing that with us.
Happy to.
Well, as you know, we've got this whole series dedicated to the role that Medicaid and EPSDT specifically are playing with respect to youth mental health. And you are one of the experts when it comes to Medicaid policy and kids' health. So we want to spend some time with you talking today about that. There are a lot of misconceptions out there, and not enough people know how strong of a program Medicaid is when it comes to youth mental health. So let's just start there. What are some of the biggest misconceptions about Medicaid, and how are those misconceptions shaping public policy?
Well, I think that's a great question, and probably not one we have time to answer on this podcast because there are a lot of misconceptions. And I think a lot of people just don't know the important role that Medicaid plays. And for us from the children's hospitals, obviously we're focused a lot on kids. And there is a lot of misunderstanding or not realizing that children are the major beneficiaries of the Medicaid program. 37 million children in our country are covered by Medicaid. That's half of all kids. And so when we say that to federal policymakers, we often get wow, or, a light goes off like, oh, I didn't realize that Medicaid's role for kids was that big. And also, I think just a misunderstanding of what the Medicaid program provides for children. It is tailored to kids. It has a benefit package that's tailored to children, and the role it plays for kids in rural and small towns. 40% of kids in rural and small towns are covered by Medicaid. Half of all children who have some type of special health care need, which could be a behavioral health need or another type of medical condition that they need care for and treatment for over a long period of time. There's also 3 million children that are in military-connected families. So you can just see like all the kids in our country that are really impacted by the Medicaid program. And then when you think about what Medicaid supports, Medicaid is the backbone of the pediatric healthcare system. Since so many children are covered by Medicaid, their providers are supported by Medicaid. So for instance, children's hospitals on average, 50% or more of the kids in their hospitals are covered by Medicaid. So that support that's provided to children's hospitals, pediatricians, other pediatric providers is really crucial to their ability to provide access to care for children. So those are just some of the things that, we highlight in terms of the role for children. And it's just a very vital program for kids. And we need to look to how can we strengthen it? How can we strengthen it overall? But I think children's behavioral health is a major area that we'd like to see improvement in.
So often when you're talking with lawmakers specifically and trying to educate them about Medicaid, they certainly understand Medicare. Like no one's confused about that program. Why does there tend to be this ongoing challenge with having them understand Medicaid in that same way?
Well, I will say I'm seeing improvement in that. I have been doing this for, a few years, as Heidi knows. And, previous in my career, we'd go in and say that Medicaid covers this many kids, and it was just like blank stares, right? I will say in our current conversations we're having with Congress, with the new administration, I'm happy to say there is more of an understanding that Medicaid does play a vital role for kids. I think it's like taking the next step to make sure that policies that may seem like they're not focused on kids, right? Or that would be something we could do and that wouldn't impact kids. They do. Oftentimes it does. The other thing I think is different is the Medicare program is run by the federal government. There's not a federal state component like under the Medicaid program. So they can see a lot more in terms of the data and what's happening. And obviously they control a lot more. They can set the policies from the federal government. Whereas with the Medicaid program, it's a shared partnership between the federal government and states. So I think that's another reason why they often go right to Medicare. But I do think that, Medicaid has gotten a lot more attention over the past several years, and there's a better understanding of it. I think obviously there's still more to go that we can work on together to, first of all, defend the program and not take a step back from where we are today, but also look at how can we springboard ahead to start to address some of the gaps that we're seeing in terms of children's mental health and in terms of other areas for growth for the program.
I have a silly question here probably, but you mentioned a couple of times here the shock and awe that people have when you mention the number of kiddos that are on Medicaid. What's driving that shock and awe? Like, are people surprised that there are that many people utilizing the system, or they expect that more people have private insurance and therefore their kids should be covered? Like, why is that astounding to people?
I just think that, everybody has a different view of what the program is. And as I said, like with the Medicare program, they can see a lot more. It's a national program. It's completely controlled by the federal government. And Medicaid is a state and federal program. So, oftentimes we'd go in and talk to federal policymakers. They'll say, go talk to the states, because the states do have a lot of authority to do things under the Medicaid program. So I think it's that, many people do think that more kids are covered by private insurance. I also think some people just, we're doing this work day to day, so we're into all the details. But there are families who have private insurance, as we all know, but their private insurance won't cover private duty nursing 24/7 or therapies or certain supports or services that they need. And Medicaid will wrap around that private insurance for children with complex conditions who are eligible for the Medicaid program. So I don't think there's a lot of visibility into that in terms of there's kids that are on Medicaid and that's their insurance, but there's kids who are on private insurance who get that Medicaid wrap because there really is no private insurance that covers some of these services. And for children who need it, that's how they live day to day and live their best lives. So it's kind of a complicated program too. I've been doing work in Medicaid for many, many years, and there's still things that I'm learning about the program. So it's hard to convey that in maybe you got 1 or 2 minutes with a federal policymaker to really make your points. And there's not enough time to get into a lot of those really important parts of the Medicaid program.
Well, and to put a fine point on that, I mean, for so many kids, these services are vital that can be kind of life or death in ensuring that their care needs are met in a consistent, quality-driven way, that Medicaid is essential for them.
Yes, it is. And there's many kids that are in that situation, and many kids that we all know. And, it could be one day you don't need those services, your child doesn't need those services, the next day they do. And so having that there for them to really be able to support them and, again, live their best lives is really important. And I think more and more federal policymakers, though, they'll know somebody who was impacted by the Medicaid program and, relied on that care. And I think that also helps too, obviously, having that personal connection.
When you talk about Medicaid and sort of the beauty of its expanded benefit program, Aimee, so many people think of Medicaid like traditional insurance. And I don't think most people, even certain recipients, understand sort of the distinction between an entitlement program that Medicaid is and insurance in its traditional form. So can you just take a minute and walk us through some of those pieces and why Medicaid isn't like your mama's insurance?
Sure. So Medicaid, as you said, is an entitlement program. So there's federal rules. If your child meets the criteria to be on Medicaid, they're entitled to get Medicaid, whereas insurance product, is offered to you. You can participate or not. Also, Medicaid has actually a number of federal requirements for children. First of all, to say children who are in certain incomes, states should be covering them under their programs. Children who have certain healthcare conditions where they're going to need, as we talked about, ongoing healthcare services, they should be covered by the Medicaid program. And if they meet that requirement, they need to be covered. I think another key difference is the benefit package that we all know, early periodic screening, diagnostic, and treatment services is the technical, multi-word title for it. But really, it's a benefit package that's tailored to kids and what they need. And it includes prevention, early screening. And then if there's a problem that a physician determines, like this is an issue that needs treatment, the Medicaid program has to cover that, any medically necessary services. So it's a wonderful support and promise for America's children. We can get into a little bit of inconsistency on how it's implemented, but it is a federal, requirement. And so it is something you can point to and you can hold folks accountable if it's not being provided. And it's supposed to ensure that children, get the services that they need, even if under the Medicaid program that's not covered or not covered for other beneficiaries under the Medicaid program. It needs to be provided for kids. And so it's a wonderful thing. And private insurance doesn't have that, and I think that's one reason why Medicaid wrapping around private insurance happens so much, because for most private insurance, you get to a certain limit, therapies or private duty nursing that we mentioned before, and you can't continue to access those services. And for children with special health care needs, they're going to need those on an ongoing basis, sometimes just to maintain their current function and what they're able to do on a daily basis. So it's really critical for them. And Medicaid is really the only way to access some of those services.
Well, I love how you've beautifully laid out the safeguards that Medicaid is providing and ensuring that we're having this kind of consistent continuity of care. The thing that's going through my head is, what if Medicaid weren't available for children? What would the world look like then?
Yeah, I really don't want to think about that world. It's really, because as we just covered, Medicaid is covering 37 million children. So that's like access to healthcare coverage for that many children. Who else is going to pick that up? That's not going to be something that's, okay, we'll just move them to private insurance. That's not available. That's why Medicaid is there. We've talked about the benefit package and the uniqueness of the Medicaid benefit package tailored to kids who need it. What would happen for the kids who have private insurance? Their child has a medical complexity. They need 24/7 private duty nursing. That's not going to be provided anymore. They need more than 10 therapy visits, occupational therapy, so that their child can feed themselves as they do every day and keep that function up. For all the children who are relying on Medicaid to provide mental health services and behavioral health services, where are they going to be able to get those services? There's already gaps and holes in coverage and access to care there. So it's really, the program is really vital for kids. The other thing I'll say is for providers who rely on Medicaid, if Medicaid is gone, so children's hospitals, for instance, 50% of their support for what they do is immediately gone. And they don't have Medicare. They don't have another big payer to fill that 50%. So you're a children's hospital, and now you need to think about, what are we going to cut back on? Are there certain service lines that we will not be able to sustain? If they have to cut services, they will have to cut services for all children. So there's even an impact more broadly on children who aren't covered by Medicaid. If the Medicaid support goes away, there will be services that pediatricians aren't going to be able to provide, that children's hospitals aren't going to be able to provide, and that would affect all children, not just children on Medicaid. And that would still be a big thing for the 37 million children on Medicaid if it was targeted to that group.
Well, it sounds like it has some pretty catastrophic consequences if that were to happen.
Yes, for sure. We want to provide early care. We want to address things early so that when children become young adults and, further in their lives, that they're as healthy as possible, that they can work, they can participate in their community, they can, do all the great things. But you're not going to put the investment in early, that is going to affect that, their lifelong journey and what they're able to do and their contributions to our country.
It makes me think, like, if we just took K-12 offline tomorrow, like all public schools are no longer available and kids get to fend for themselves when it comes to their educational experience, right? This is sort of similar by way of healthcare. Like you pull down Medicaid and there's nothing else that then stands up to replace, fill in, and meet that need. It's just like, the ripple effects, to your point, Aimee, are so extensive. And we're not talking about those as often, those broader ripples. And we certainly aren't talking about it in respect to the mental health space and how many mental illnesses begin in childhood and can be prevented in childhood when kids get access to the care that they need.
Yeah. And when they can, catch things as early as possible and get the support that they need, that does make a difference down the line. And we didn't even talk, you mentioned education. I mean, if you don't have health care and access to health care, or you aren't able to access mental health services, that's going to affect your ability to learn and grow and thrive. And so we'll have a lot of implications across the board for kids, but also for our country as we go forward.
I think about it specifically since so much of my work is focused on mental health care and the role that Medicaid does play in serving mental health needs of kiddos today. How do you think we make Medicaid policies more effective in supporting youth mental health?
Well, the first thing I will say, because we're in an environment where Medicaid cuts are on the table. So I don't want to forget to say, because it is really
may not be possible at all.
No. I think step number one is making sure we don't take a step back. I think that we have, Medicaid, as we've already talked about, and you both know, is so critical to children being able to access and address their behavioral health needs. And right now, with the size of cuts that we see being discussed at the federal level, those will have an impact on what states are able to provide under their Medicaid programs. If there are significant cuts to the Medicaid program from the federal level, that goes to the states, and that affects what states are able to do. States already, as you both know, have to make tough decisions. How are they going to prioritize? Where are they going to put funding? And there are states that have done things to address children's mental health. Will they be able to sustain those? Will they be able to grow those if there's cuts coming down from the federal government? So I think the first thing is we need to make sure we don't take a step back working together because of the role Medicaid plays across the board, but because the really critical role it plays, especially for children who have behavioral health needs.
Right.
And then I think we need to look at, we would like to be having the conversation about how do we strengthen the program? How do we work together to make sure the program does a better job? And this is one of the key areas. There's not enough of a mental health workforce across the board, for kids, who need some help early on, for kids who need more intensive help and care. And how can we best support that? I mean, we believe there needs to be additional federal investments to support state efforts to really make sure that those services and kids can actually access the care that they need. The benefit that we talked about is only good if kids can actually access those services, and making sure that there's support all along the continuum, as you've both mentioned, early, as early as possible, connecting kids to the care and support that they need. But we also see, kids with very intensive needs right now, and there's not enough providers. They're ending up in children's hospitals, in emergency rooms. And so also making sure in that kind of intermediate level of care that we can either prevent hospitalizations or help kids as they make the transition from a hospital setting back to their homes and communities as well. So it does take dollars, though, and it is a tough environment right now to access additional investments and dollars into the Medicaid program. But I think it is something that's needed. I think also states taking a look at where are we on our delivering on the promise of EPSDT. The federal government did release guidance last fall to states on EPSDT and what they're doing, and they did look in particular at mental health services and behavioral health services. And so I think states, taking a look at that and see where are we in our state? Where are the gaps? This is the continuum of care. Where is the gaps that we need to work on with other partners locally and in the state to be able to really build up and bolster that continuum of care?
When you talk too about the state component of things, Aimee, and the recent guidance that came out on using sort of the full benefit package that Medicaid has to offer to come into the state and serve kids with mental health needs, as you're looking across different states and you're hearing from different children's hospital partners and community partners, what do you feel like tend to be the biggest holdups for states in implementing sort of to that full degree? Like, it's not a clear requirement, right? Like, the benefit package is the benefit package.
Yeah.
And yet so many of us continue to fight for full implementation. So what do you feel like are those common themes that hold us up in seeing that happen?
Well, I mean, I do think generally, states, they want to meet kids' needs, right? I think one of the biggest things is that it's competing priorities. They have to balance their budgets. The federal government doesn't have to do that. States have to do that. And so, they don't have unlimited resources. And so I think they're trying to, they struggle with, because, they're hearing from us, they're hearing from, a lot of other groups, and, they're all probably valid areas that need some focus. So I think it's probably competing priorities, their own staffing, the resources that they have to put into it. But there have been states who have taken steps. I think we all realize it's not going to be from like where we are today to the perfect in 1 year. Like, what steps can we take together to really move this forward, maybe map it out, and then we're going to take this first step and we're going to keep building towards that. But like I said, right now, I'm sure a lot of states are very worried because they're hearing about discussions of cuts. What's that going to mean for our overall program? And then what is it going to mean for some of the specific initiatives and projects that we would love to undertake, but they're just not sure they're going to have that support right now. So I think that's probably, a lot of what they grapple with. And the EPSDT requirement is a broad one, right? So map is, you just say, okay, check 1, 2, 3. I mean, there's a lot of, you have to look at. So it's not an insignificant undertaking. And I think a lot of them do want to improve what they're covering for children, particularly to address children's mental health and behavioral health needs. We hear that from the national level, but I think it's just competing priorities and lack of resources in many cases.
What I really am hearing from you that I think is resonant for so many people that would be listening is this: now's not the time to pull back. But we're also saying that in the context of we're seeing contracting fiscal environments and abilities to make decisions based on the unknown or uncertainty of what's happening at a federal level. Like, where do you, in the role that you serve in, find kind of the calm in the storm to recognize that, yes, these things are happening and no, we don't want to necessarily pull back? Like, where's the midpoint that we kind of meet back in the middle in uncertain times?
Well, we don't stop talking about the things that we need to do to improve. I think we just have to be more pragmatic about what those things look like. And like I was saying, maybe taking a step towards it. We're not going to be able to transform everything in 1 year, but what are the steps that we can take that really improve the program, but they're not too big right now in this environment? And so we also do our best to share. Obviously, we're representing 220 children's hospitals across the country. There's a lot of good activities that are happening in children's hospitals, that are happening with working with states to really get positive policies done. And we've tracked some of those state policies and we want to share those across. So sometimes, it's kind of doom and gloom from the federal level, but there is a lot that we can all learn from each other. And that also informs our federal work as well. So we're working to do a better job of that. And then at the federal level, there are things that are strongly bipartisan. We're working on a bill called Accelerating Kids' Access to Care. It would help streamline out-of-state provider enrollment when a child has to come to a children's hospital from another state. There's a lot of paperwork that's involved and it can really delay care. And this is a strongly bipartisan bill. We have strong bipartisan champions, and it's something that we're working to move forward, which would make a real difference in kids' lives. And so we are really happy that there's continued strong support for that and want to see that moving forward as well. And we're making the case for that, along with other things as well.
That's great to hear. And I think to build upon that, if I'm a parent that's listening and maybe have a kiddo that has more acute needs and feeling a lot of fear around the uncertainty, what do you think we can collectively do? And not just in your role, but, as a community that supports youth and specifically youth struggling with mental health, like what can we do to band together to get through this and navigate these uncertain times?
Well, I think connecting with other families who are facing similar things. I think in many states, there's coalitions, who are banding together to advocate. I think even individually, looking up your members of Congress and sharing your story. This is what we're facing. This is what I'm concerned about. These are the gaps that I am experiencing for my child. To your member of Congress, we have what's called Family Advocacy Day, where we have families come to DC in the summer of every year in June, and they go in and talk to their members of Congress and they tell their individual stories. And when we go back and meet with those same members of Congress later on, just us from CHA, they'll remember those families. They'll remember the child's story. And, there were times where bills passed and the champion would mention the child that came in to make the case for that bill. So I think sometimes we feel that our story is one story and it's not going to make a difference, but these stories do make a difference. And it's real examples. And that's what they want to hear from their constituents, real examples of the impact of either challenges currently or what you're worried about as you're hearing what's happening at the federal level. So I think weighing in individually, but also looking where you can get connected with others who are maybe facing similar challenges. That helps all of us when we're facing something, to talk to somebody else and to learn from each other, and you get strength from each other too.
What's the foundation of connection?
Yes. Yes.
Love it.
Aimee, I can't thank you enough. I know Jason and I were so excited to have you join us for this, and your wealth of experience and knowledge in this space is so helpful. So thanks for taking the time and really helping illustrate the value proposition of Medicaid and what it brings to kids in this country, and why we all need to stand together to work to protect it and continue to be involved in the conversations to help improve it as it pertains to all kids getting the services that they need. Thanks for your work, and thanks for being here today.
Thanks for having me. I will talk about Medicaid anytime asked.
I just want to add, thank you for your steady voice in uncertain times. Like, I know we all need that. And just to have some levity to the conversation around the importance of, like, we're going to get through this. I think that's really important. And having these conversations are so valuable. So thank you.
Thank you.